Hi, I'm Vicky. I'm a third year learning disability student, nurse, and I am also part of the We Student Nurses team. And I'm here today to talk to you about a death and dying week that I did with the We Student Nurses team. And that was to engage students and nurses to talk about death and dying and to get a little bit more comfortable with the topic. You ask why? It's taboo. None of us want to talk about it, but it's important. Part of our nursing code tells us that we need to maintain a patient's dignity, and that means through life and death. So to do that, we need to give them a good death. Sounds terrible, a good death, but I would much rather have someone talk to me about that and have my wishes so they know what I would like, how I would like to go about treatment. You know, those sort of things are really important to a patient who is at their end of their life. Also, it was to also engage as well that if a patient comes in and they need to grieve and they need your support as a nurse, we are there to support them, and that is important as well. So I spoke to two ladies who were bereaved by suicide, and they did a podcast for us, and they spoke about how it could be a week, a month, 10, 20 years later before that grief really hits them, or, you know, manifests into some sort of physical issues, so that they could be in hospital and you could not know that they had lost someone due to suicide, and that grief hits them. How are we supposed to deal with that? Well, the only way we can is by listening, talking, and holding that person in their grief to help them through it. And as nurses, this is something we need to remember, we need to do, no matter what time of their life they're having this grief. So why is it important? Well, for that reason, we need to be able to give people dignity and time. We need to be able to have that respectful conversation and feel comfortable, so that we feel comfortable having that conversation. Our patients feel comfortable in having that conversation with us. It's important. Families, if a patient has died, it's important to be able to talk to their families and help them through that time. In relation to people with learning disabilities, it's more our language that we use. So there was a podcast by Irene Tuffrey-Wynn that I did with her, and she talks about how we need to use direct language. So rather than saying they're having a sleep or they've passed, we need to be direct, and we need to use words like death and dying. Because for someone with a learning disability, if you say they're sleeping, they'll think they're up in bed sleeping. If they've passed, they might think they're passing the window to go to the shop. They're expecting that person to come back. So we need to make sure that they understand the finality of death. And this would go so as well for children. So we're looking at children. They use very direct language, and this was one of the important things for me. I wanted to cover all areas, so all areas of nursing, so children, mental health, adult, as well as learning disabilities. So our language is very, very important. The barriers I faced doing this this week was really down to times. So I had people from all areas, all backgrounds, and their busy schedules were difficult to arrange around. So I had to use deadlines and be quite directive in the way that things needed to be done. So I would have to say, look, I need this in by this date, and I would get it by that date, but it needed to be quite directive. I think I found the most difficult area to engage was mental health. This was quite a difficult one to overcome, but I did. And as I told you about the ladies who were bereaved by suicide, that is how I brought the mental health aspect in. So we spoke about, you know, it might not be the person that's bereaved that was having the mental health issues, but there are mental health problems within, obviously, suicide, and how they can identify those. So as as they were saying, as nurses, we need to just remember that that person might have an issue when they're not talking about it. So that's looking at our body language, their body language, seeing if we can pick up any cues. But it is very difficult, and we need to just be aware of that. So what did I learn from this week? So I learned that I have the ability to use different leaderships styles. And it's important because some people need a directive approach. Some people need a more supportive approach. And that is important, to know what people need and how to go about helping or supporting to get the job done. And you have to take that judgment on your own. I found it quite difficult at the start, and I think by the end of it I very much learnt a whole new skill, if I'm honest. So why is it important to be inclusive? As I said, I wanted to include every field of nursing within this. So why is it important? So normally the people that are excluded from these sort of things are the learning disability community, the communities with mental health issues. And it's so important that they're included. They have a right to have their voice heard. And, you know, when we say learning disabilities, we're all just we're all possibly having some sort of mental health issues. I myself struggle with depression. Another person might develop dementia. And just because those conditions are there doesn't mean someone can't have a decision made, or they can't make their choices for themselves. They just need that extra support. And that goes for learning disabilities as well. They need that extra support to make those choices. But they have a right to be heard and their wishes to be covered. And I think that's really important. And as nurses, we need to find ways to be able to implement, you know, a person's choice within their plans, within their future wishes. And these can be done with reasonable adjustments. So I've just written my dissertation about reasonable adjustments for people with learning disabilities and dementia. And we talk about how, you know, it can be simple things. So there is a program called Let Me Decide for people with dementia, so that they can have some sort of decision in their end of life care. Why can't that be adapted for someone with learning disabilities and dementia? Of course it can, but we need to do that. It's not going to happen just because we've thought about it. We need to take it and we need to develop it. And that's why we need to be important. That's why we need to realise that it's important, and that is really helpful, and that can make a difference to our patients to have their wishes thought of. And these can be achieved by those simple, reasonable adjustments. So, why should all fields of nursing learn about people with learning disabilities? Well, as I've said, I'm a student learning disability nurse. I think everyone should be aware of the impact they can make on a person's life, and especially on a person's life with learning disabilities. However, all fields of nursing need this extra training. They need to learn about people with learning disabilities and how to communicate, because they use primary and secondary healthcare as all of us. And it has been heavily reported, especially by MenCap, that, you know, this community doesn't receive equitable healthcare. So, you know, and the leader report as well also highlights that people with learning disabilities, they're dying so much earlier from preventable diseases. So, you know, where the general public might have that treatment, because someone with a learning disability can't communicate, they could get late diagnosis, or they might not be able to communicate how verbally what treatment they would want, or someone might not think that they have capacity to understand it. Why? So this is where our reasonable adjustments come into force again. We need to be able to make those adjustments. We need to be able to give those people that choice on what treatment they want, on how they're doing. We need to also be able to listen to them in a way that they can communicate. And that is something that I'm so passionate about. So we have to listen. And I think the minute we do that as nurses, we're going to be able to help, be able to support, be able to treat people with learning disabilities so much more effectively. And this, again, can be done just by additional training around learning disabilities and communicating. Because yes, they do communicate in a different way. Some people cannot verbally communicate. It does not mean they don't have capacity. It's just they need that information in a different and accessible way for them. And if we learn all of this as different fields of nursing, then we're going to make improvements to their care, but also we're going to make healthcare more equitable for that community. So they're going to be on an equal standing, an equal footing as everyone else who uses the primary and secondary health sector. Thank you very much.
Now that we have listened to Victoria and how she developed a Death and Dying Week to open up difficult conversations with people, what leadership skills did Victoria display? Well, firstly, she spoke about the importance of time management. As nursing students, we have a busy life juggling all of our commitments, and therefore our time is precious. So by understanding how to use our time wisely, this will help us determine what we can and cannot achieve and within what time frame. Tools such as the Pomodoro technique will allow you to become more productive with your time. Victoria also spoke about how she had to be assertive to ensure that deadlines were met. Assertiveness is a communication style where the leader is self-assured and confident, but they aren't aggressive. Being assertive ensures that people are held accountable for assigned tasks and also gives them clear direction of what is expected from them. And finally, Victoria spoke about how she adapted her style to suit the needs of the people she was working with. Charles Darwin, best known for his theory of evolution, said, "The most important factor in survival is neither intelligence nor strength, but adaptability." Being fluid in your leadership style helps you to understand your team and their capabilities, along with improving your relationship with them. Thinking about a team that you're a part of, what styles of leadership would each team member be most suited to? And how easy do you think it would be for you to adapt?